Hi, my name is Beverly Chung Brown, and in this short video, I will be doing, as part of an assignment for Nursing 608, how I would set up an interview meeting with a nursing theorist. The nursing theorist that I would like to talk about today is Dr. Phil Barker, who developed and created the Tidal model of mental health nursing in the 1990s with a philosophical recovery approach to mental health clinical nursing practice. The theoretical frameworks surrounding Dr. Barker's model is Peplow's interpersonal relations theory, the theory of psychiatric and mental health nursing derived from the need for nursing studies and empowerment with interpersonal relationships. Dr. Barker actually grew up in Scotland around water, and interestingly enough, the name Tidal is a metaphor that he used for representing the storms and difficulties of a person's life experiences. I will be asking Dr. Barker questions based on the specific concepts of his Tidal model mental health nursing relating to my clinical practice in an outpatient mental health department. The scenario that I would like to present in briefly is a 32-year-old male with a history of schizophrenia. He lives with his parents and younger brother, and he's always been unemployed since he finished college. He has been stable on long-acting injections for over 4 years and sees a nurse every 4 weeks for his injection. He has never worked, and most of the times he's playing video games in his room, which makes him isolated from family and from his brother, who he doesn't really have a good relationship with. More recently, Joseph has verbalized to the nurse, myself, that his parents have been stigmatizing him because of his illness. He believes that they treat the brother a little bit differently than how they treat him, as the brother is more functional and he's working outside of the home. He does not believe that the parents want him to be independent. So the issues are, patient would like to be more independent. He is hoping he can find a place for himself, so he is living away from parents to develop his independence. So also, there's family conflicts in the home. There's always arguments, in particular with the father. And Joseph believes that the father makes life difficult for him. So based on this scenario, I would like to ask Dr. Barker the following questions. Based on this scenario, what section of the Tidal model would I use for a patient to tell his narrative? So the rationale is that in this model, the holistic nursing assessment would give an overview of Joseph's current problems, how it started, how it affected him emotionally, functionally, and impact on his relationship with the parents and the brother, and for Joseph to find meaning in the situation and how the nurses can help. Second question is, what is nurses' objective assessment? When does it become significant if the model places Joseph's narrative front and center? So the rationale, Joseph may not see the bigger picture and lacks some insight into his own disorder and its impact on his abilities. What would be the most effective way to motivate Joseph to actually sign up for his courses? And I didn't mention to say that Joseph wanted to go back to school to do his IT courses. Rationale, in the Tidal commitments on the number 8 commitments, it says to craft a step beyond, which means that the nurse could create an action plan with Joseph to get him moving forward to reach his goals. What is the family's role in this recovery approach the model informs? So the rationale is, we know in the model there are 3 dimensions: self, world, and domain. I'd like to just quickly mention for others' domain, in the interest of time, where in the model it states that emphasis is given to supports and services that Joseph would need, including family relationships, the need for social leisure activities. And lastly, Dr. Barker, what would you recommend from your model's framework in terms of how the patient can be helped if he's not willing to embrace being empowered? In your model, you said the model is about empowering the person. And so I believe that we'd have to challenge Joseph if he's not cooperating or be willing to actually continue to accept the fact that the nurse is carrying out the model, trying to encourage the patient to be empowered. So these are all the questions I have for now, and I've run out of time. I hope you enjoyed the video, and I hope it was useful. Thank you for watching.